the first glance you see that it looks like a canine, and if you see from the occlusal aspect you can see that there is one lobe, two lobe and three lobes. That is, it forms by three lobes buccally, and the lingual portion is a well developed lingual lobe. Now, like the canine and the anterior teeth, this tooth also develops from four lobes. There are a lot of similarities with the canine. The first step where it is similar is the buccal aspect. In the buccal aspect, you can see that the tooth shows a single cusp, a pointed cusp that you can see. And when you look at it from the mesial distal or the occlusal aspect, you will find that the buccolingual dimension, that is from here to here, the buccolingual dimension is similar to that of a canine. Not only that, the mesial aspect shows that the occlusal portion is sloping much more lingually. Usually the premolars have a taller lingual cusp, but in case of the mandibular first premolar, the cusp is shorter and it gives this slope which makes it similar to that of a canine. When you see from the buccal aspect, you can see a very prominent buccal lobe. You can see the prominent buccal lobe, and it forms a ridge which you can appreciate it more when you see from the top. And roughly it is trapezoidal in shape, as you can see here. It is wider at the contact point and narrower at the cervical portion. And this trapezoidal pattern gives almost a flattened, although you can see a concavity here, you can see that cervical line may be flattened at some portions. Now when you look at this tooth from the labial aspect, you will find that the tip is more mesially placed. So if you look at this tip here, it is more mesially placed compared to that of the midline. This kind of says that the mesial slope, this one, mesial slope, is shorter than the distal slope. And occlusally, you can see the typical lingual convergence. You can see that the mesial and the distal portion is lingually convergent. Outlines, let's describe the outlines. So the moment you pick it up from different aspects, let's pick it up from this area, you can see that there is almost a flattened or a curved cervical line from the mesial aspect. This is the mesial point. So you can see that at the distal portion, you can see the outline is a little concave, and you can find that the concavity is there more on the distal aspect here. The distal outline is longer, mesial outline is shorter, and the cusp tip is more mesially placed. The root length is roughly 14 millimeters. However, the canine has the root length which is much longer. Let's turn around to the lingual aspect. From the lingual aspect, you can make out the lingual cusp. Now, this lingual cusp is typically shorter than the buccal cusp. Since the lingual cusp is shorter, it is roughly 2/3 that of the buccal cusp. You are able to see the buccal triangular ridge here. The buccal triangular ridge starts from the buccal cusp tip till the central groove, which can be noted from the lingual aspect itself. And the most characteristic feature about this aspect is the mesiolingual groove. So you can see this groove, which is actually an extension of the central groove. It crosses the mesial marginal ridge and then extends down into the lingual surface. It usually ends at the mesiolingual line angle in this particular region. It characteristically separates the lingual lobe and the mesiobuccal lobe. The roots also taper. You can make out that some portion of the distal and the mesial surfaces can be visualized from the lingual aspect. That is because of the lingual taper. As you see from the top, the lingual portion is narrower here. This lingual taper makes it characteristically seen from this aspect. Now let's look at it from the mesial aspect. The mesial aspect shows a typical rhomboidal appearance. This rhomboidal appearance is because of a difference in the crests of curvature on the buccal and the lingual aspect. The crest of curvature on the buccal aspect is in the middle of the cervical third, whereas the crest of curvature on the lingual aspect is in the middle of the middle third, which is much higher placed. That gives an idea that the whole crown is curved lingually. The cusp tip, that is the buccal cusp tip, is roughly centered on the root, and you can make out that the buccal cusp tip is more centrally placed compared to the other premolars that we usually note down. The lingual cusp is 2/3 that of the buccal cusp, which is very characteristically noted from this particular area. The buccal crest of curvature is more in the cervical third, may come till the middle third also, sometimes in some specimens. But the lingual crest of curvature is almost always in the middle of the middle third, and it is very close to the cusp tip. So the cusp tip is here and the crest of curvature is somewhere in this region, which is very close to that. The mesial marginal ridge here, as you see here, the mesial marginal ridge is sloping downwards, and it is usually parallel to the buccal triangular ridge. So if you position it correctly, then you will see that the buccal triangular ridge, which you can see here, and the mesial marginal ridge are roughly parallel to each other. The crown appears to be tilted lingually. This lingual tilt is mainly because of two important reasons. One, the lingual crest of curvature is higher placed. Secondly, the lingual portion of the crown is outside the lingual portion of the root, which gives a characteristic lingual overhang appearance. The mesiolingual developmental groove can again be appreciated from this aspect, because it is in the mesial and the lingual surface. You can make out that the mesiolingual groove is present in this particular location. The cervical line in this portion is curving more occlusally, unlike the labial and the lingual portions, which is similar to the other teeth that you see in the anterior portion. The root is tapered, and usually it shows a deep developmental depression on the mesial surface of the root, which you can make out from an angle like this. You can make out there is a concavity in this particular region, and we will be having better anchorage because it's a single rooted teeth. Let's go to the opposite side, the proximal surface. So from the distal aspect, the typical appearance is that the distal marginal ridge is kind of perpendicular to the long axis of the tooth. Also, there may be a concavity seen just below the contact area. A characteristic appearance which you should note is that the distal contact area is usually centered. So if you look at it here, it's in this position. So buccolingually, it is usually centered in the tooth, whereas the mesial contact area is actually anteriorly placed. So this is one of the differences between the mesial and the distal sides. The developmental depression on the root may or may not be present, but if present, it is shallow in nature. Let's go to the occlusal aspect. From the occlusal aspect, you can see a typical diamond shaped tooth. So you get this kind of an appearance where you can see a diamond shaped outline. Some specimens may be circular in nature, and there is a prominent buccal ridge here. You can see the prominent buccal ridge, and a well developed marginal ridge can be noted on both the mesial and the distal side. This is the mesial marginal ridge, this is the distal marginal ridge. You can also appreciate the triangular ridges which meet in the central groove in this particular region, and that central groove that is formed is usually in the form of a smiley. So you can see a smiley there, and the mesial portion, like you see here, the mesial portion is linear, whereas the distal portion here is semicircular in nature. The distal fossa is circular, and the distal developmental groove may have accessory grooves, and there are 8% chances that this groove may break the distal marginal ridge also, but it always breaks the mesial marginal ridge, giving rise to the mesiolingual groove. So these are the characteristic features of the mandibular first premolar.